Hello, my name is Claudia Bertigay with Divine Home Care Services, and I'm here today with Paige Fitzgerald from TexMed Home Health, and we're going to speak a little bit about infusions, what they are, and how you can benefit from this.
Thank you for having me. I appreciate it. I'm Paige Fitzgerald, Clinical Liaison with TexMed Home Health, and I just wanted to let you all know that part of what we do as a home health agency is we do in-home infusion. So that can be in a combination of things. We offer different types of feedings to patients. So any patients that are home that may have a feeding tube, any kind of J tubes, G tubes, NG tubes, we can offer the feedings and the teachings in the home to the patients. Any patients that are perhaps going home on any type of IV antibiotics, maybe they have some long-standing infections or maybe some oral antibiotic resistant infections that might require some IV therapy. We do have an infusion company that we partner with that can compound the medications, deliver those directly to the patient's home, and we can infuse those in the comfort of the patient's home.
Wonderful. And I know infusions are a great therapy or way to get the nutrients or the antibiotics into your bloodstream quickly versus doing orally. In what situations, I guess, would clients not be or patients not be able to take oral medication where they would need infusions?
So sometimes, let's take a relatively simple patient. So maybe we have someone who has had a knee replacement surgery, and after surgery they go home on pain medication, they go home on oral medications, and then a few days after surgery they realize that maybe they're having some pain in that knee, and they go back to the doctor, and the doctor says, you know, we really need to clean this knee out. And when they go back in and they realize that the knee has an infection and we need to be a little bit more aggressive with therapy. So the doctor says, I think that you've been on oral antibiotics for a while, and so now I think we need to try to do some intravenous antibiotics. So maybe something like a vancomycin. Several years ago, that probably would have required a patient to go to a rehab facility. And those courses of antibiotics can last anywhere from 3 to 4 days to sometimes, 6 weeks. And so that's a really long time for somebody to be in a rehab facility. So we partner with this infusion pharmacy. They deliver the medications to the patient's home. We can infuse them right there. We can also do all of the labs that are required for the patients to report back to the doctor to make sure that we have a therapeutic medication range.
That's wonderful. So many people can benefit from that, especially now with COVID. That's why you see us all masked up. If you can get these therapies at home, you keep your loved ones and yourself away from hopefully hospitals for a little bit, unless you really need to go, of course, and get the service that you need.
Sure.
So thank you so much for
welcome.
everything, and we look forward to working with you guys.
Thank you so much.